Duchenne's muscular dystrophy, or DMD, is a degenerative muscle disorder caused by heritable genetic mutations. DMD is one of the most common and severe forms of muscular dystrophy, affecting 1 in 3,500 boys worldwide. It's caused by recessive mutations in the dystrophin gene on the X chromosome, hence why it affects males for the most part. They only get one copy of the dystrophin gene, so if it's defective, there's no other healthy genes to take its place. However, there remains the question of the girls. If it's possible for them to have DMD, do they? Female carriers of the disease usually are unaffected by the mutation because they have two copies of the dystrophin gene. If one of them is mutated, usually the healthy dystrophin gene takes over and the mutated X chromosome is silenced in cells. In some cases, however, the healthy gene may not work efficiently, and the cells may choose to express the mutated version of the gene. This can lead to girls having skeletal, cardiac, and cognitive symptoms similar to muscular dystrophy. These girls are termed manifesting carriers. Most carrier females, though, about 80 to 90%, have no problem with their skeletal muscles. Some have mild muscle weakness, fatigue, and pain or cramping in their muscles, but rarely a carrier has symptoms that are as severe as those of a male with muscular dystrophy. Carrier females have an increased chance of changes to heart function, and although it's not known yet how common heart changes are, some studies have estimated that 10 to 50% of carriers have heart changes. It's estimated that about 1 in 50 million girls have DMD. In order for a girl to have DMD, she would have to have both X chromosomes carrying dystrophin gene mutations, meaning that in one case, the father could have already had DMD, and the mother is a carrier that passed the X chromosome with the mutation to her daughter. In an ideal scenario, the hereditary nature of the disease and the debilitating experience of having this disorder would warrant that a father with DMD would likely have a genetic counselor to advise DMD patients on having children. In the same ideal scenario, it may also be expected that for a planned child, the mother may also go in for genetic testing to determine if she is a carrier for the mutation. This would provide the most accurate information to parents about the risk of having children with DMD. In reality, though, sometimes things happen differently. Another important point is that 30% of children born with DMD did not inherit the mutated X chromosome from their mother, but instead it was a spontaneous mutation that started new in their own genetics. That would mean the mother is not a carrier. In the case of a female with DMD, she may have received one mutated X chromosome from one parent, and the other X chromosome had a spontaneous mutation in the dystrophin gene. This also is very rare. Still, it happens. There's one story able to be found online about a woman with DMD. Here's her experience. In 2017, an article was published that told the story of Feriel, a woman with DMD. She was 26 at the time and lived in France. Feriel was born as a triplet, 3 girls. One of them had cerebral palsy, the other was a carrier of the DMD gene, and Feriel herself actually had DMD. Her manifestation of the disease was very similar to boys. She fell over a lot when learning to walk, she received a muscle biopsy, and was diagnosed with DMD. She had a nonsense mutation in exon 12 of the dystrophin gene. Feriel's doctors at the time believed that the genetic test results had to have been a mistake because of how rare a female with DMD is. In fact, they believed her muscle weakness in early life was due to cerebral palsy, as her sister had. It took longer to reach the correct diagnosis because this is not a case seen often enough. Pediatricians don't consider Duchenne to be the culprit when they are trying to figure out why little girls are weak, have speech delays, or issues with balance. This circumstance can delay a diagnosis and prevent the girls from receiving the help that they may need earlier rather than later. Feriel's disease progression, however, was very similar to the progression of any other boy who has DMD. She lost ambulation at 10 years old and had many respiratory problems throughout the most recent years of the article publication, and she has had to use a breathing machine at night. Parent Project Muscular Dystrophy puts on an annual conference discussing life and progressions in the world of muscular dystrophy, and one year they heard stories of girls with Duchenne. It was a space that learned about struggles receiving a diagnosis, lack of specialized care, and exclusion from scientific studies and clinical trials. They learned there is a wide spectrum of symptoms experienced by these girls, including muscle weakness and cramps, altered balance, fatigue, cardiac changes, and cognitive and behavioral issues like ADHD and learning disabilities. The participating clinicians agreed that earlier detection may lead to earlier and better treatment of symptoms. This goes to demonstrate that there is also a female voice in this issue that is frequently overlooked, but should be brought to light for girls who have no choice in the matter.